already we have challenges with regards to problems of problems of food insecurity. And you find out that most people who engage in this prefer to do farming in cannabis rather than going to farm for foodstuff to be made available. So slowly, they are getting interested in the cultivation of marijuana rather than cultivating cash crops or any other agricultural product that can be useful for the whole of society. Because of the value, the financial value or financial benefit that they also get from it. So those who plant, those who take, who abuse these drugs, all have implications for our agricultural sector in the region as well. Prolonged conflict because of these kinds of behaviors. We see that where we have internal conflicts in our region, those conflicts have been prolonged, particularly because people are on constant supply of hardcore as well as locally produced drugs. So even those who also do human trafficking, most of them are also on drugs to be able to do those nefarious activities. So also we are talking about the social and economic cost that also involves. For socially, those who are in school, when they are in drugs, they drop out of school, which has implications on their lives and the life of the community as well. Families are disintegrated, financial losses, and distress among victims of substance-related crimes. Also, we see that the cost for rehabilitation is also very expensive. In our region, in most of the countries, we are still battling with issues of where to rehabilitate the young people who are into drugs. Where we have facilities, they are not that well equipped to be able to do that. Where they don't exist, these young people struggle to go through rehabilitation, self-rehabilitation, and even at times they actually meet their death and other forms of deformity. So this has both the human cost, which is also very expensive. By even losing one person, it's a serious concern, particularly young person who is supposed to contribute meaningfully to society. Let alone we talk about the financial cost as well that is also involved that the state will lose. So for me, we think that we should be able to focus on how do we utilize our demographic advantage to the best of our ability to contribute to development in the region. Rather than we have the young people, but they are not contributing to development because they are already being taken by hardcore and synthetic drugs. So we profile some recommendations in the report, which we also require stakeholders to also take action. And through our national offices, we are also calling for our colleagues to engage different stakeholders to be able to find a way out of this situation, to be able to address this current plague that is permeating through our region. So we're saying there is need to create space for robust government engagement to strengthen community security relationship, resilience and social cohesion in states with high record of drug trade and abuse. So most of the time, because of the way in which our laws are created, our laws are mostly arrest, detention, and punishments. And we have little to talk about rehabilitation and integration into society. So we are saying that that space should be there and government should rethink, not only looking at the prosecution and the arrest and detention, but also preventive measures, which countries like Sierra Leone, Liberia, and Cote d'Ivoire, I know they are doing very well in terms of putting in place structures and institutions to be able to handle this issue. We're also saying that drug abuse and trafficking should be approached from public health and socio-economic perspective. We should consider it like when we had COVID-19, for example, or when we had Ebola in West Africa, how state institutions, intersectorial collaboration was put on alert. And all of them were working together to ensure that they eradicate those health conditions. So also, I think the states should address it from an emergency point of view. And we were pleased when Sierra Leone, Liberia, for example, declared drug abuse a health emergency, a public health emergency. That was a very good move. And I think we would like to hear from our participants from Sierra Leone how that is going on well and how that is contributing to reducing the speed of the spread of the drugs in Sierra Leone. Strengthen strengthen multi-stakeholder intervention and coordination towards addressing drug and substance abuse among young people. And also establish peer support groups, which OneUp national networks are also doing very well. But I think it has to go just beyond those peer support groups to also involve the parents to take the community along as well. And I think we have to go back to basics, those days when we used to have the whole society approach, how society brings up a child. I think we have gone away from that. Now we are even looking at social media and all these technological advancements, which has hindered the way in which we used to bring our young ones up in our communities in those days. Technology is good, yes, but it has also contributed to some of the things that we see happening today. Promote parent-to-child communication. We don't talk to our children. We only get into the picture when things have gone bizarre. That's when most parents even realize that their children are on drugs. We have to also pay attention to our children to ensure that we're able to have that kind of conversation with them and set an example and have positive parenting as well at home. If you are a parent and you are also taking drugs, be rest assured that your children will pick after you. So how do we do those kinds of positive parenting to ensure that we show the children that we are role models right from the home? So that even when they go to, when they're exposed to society and when they go to school or go to their peer groupings, they will rather influence others to be on their side rather than them being influenced into this negative activity. And then we are also saying that create employment opportunity, because all of this we're talking about also because the youths are there, they are not employed. Even those who are employed, they are not well paid, they are not well taken care of. And societal pressure alone at times also lead them to these issues of drug and abuse as well. So this is what this report puts together. It's very detailed, and we are encouraging our national networks and all those who are online, who are also working, who are agencies of states as well as NGOs and CSOs, to take this advocacy forward. I think that's the essence of this presentation, to take the advocacy forward and to engage at all levels and ensure that we're able to deal with this problem and save our young people from this pending catastrophe. So with this, I want to stop here and hand you back to our chair. Thank you very much.
Thank you so much, Mr. Edward, for that remarkable presentation. And before I proceed, I would like to request that participants on today's webinar should please put their country, their names and designation on the chat list. So from Mr. Edwards' presentations, he has brought to the fore that abuse trafficking is not just a plague, but it's a silent emergency that needs to be tackled. He has also made it clear the actors and drivers involved in this menace. He has brought to the fore that from cannabis, the newer and more potent synthetic drugs, the availability and stability of these substances are a growing alarm in West Africa. And the impact is indeed devastating. He has also made it known that the policy brief put forward some key recommendations that talks to the fact that there's need for concerted efforts involving state and non-state actors who should be committed in their interventions towards addressing drug abuse and substance abuse among young persons. So once again, we say thank you, Mr. Edward. And now I'll be handing the floor over to Mr. Ibrahim S. Tumba, who is the Director of Prevention, Education, and Training of the National Drug Law Enforcement Agency, Sierra Leone. He will be taking us on the topic titled Actions Against Drug Abuse and Illicit Trafficking in Sierra Leone, Achievements, Challenges, and Lessons Learned. Mr. Ibrahim, you have the floor, sir.
Thank you very much. I want to tell one very big thank. Are you getting me? I want to give a very big thank to OneUp for inviting me to this platform. And I'm very happy to share Sierra Leone perspective with regards drug issue. However, I want to remind everybody that this year's theme for the United Nations World Drug Day says breaking the chains, prevention, treatment, and recovery for all. So without much ado, I will take you through the Sierra Leone concept and what we at the National Drug Law Enforcement Agency have done so far and we are continuing to do. And as a nation, what we have actually done with respect to the entire fight against drug and illicit trafficking. However, I want to ask my man that will be assisting me with respect to sharing the screen. Thank you very much over there. I want you to go to the next slide and let's look at the outline of the objectives. So if you look at the outline here of these objectives, we look at the introduction, establishment of the National Drug Law Enforcement Agency. What are the strategic mission and the vision of the agency? Of course, an overview of the Sierra Leone efforts in the fight against drug abuse and illicit trafficking, penalties for drug offenders in Sierra Leone, statistics of drug users, the challenges, and lesson plan. Then we go to Q&A. Can we go to the next slide? Yeah. Next slide, please. Our next slide gives you a brief overview of the National Drug Law Enforcement Agency. So the agency actually started the operation way back in 2002, but okay, can you please go top? Okay, establishment, okay, that's where we are. So started way back in 2002 following concerns raised about drug issues relating to the increase in drug trafficking and abuse. So the problem of Sierra Leone drug situation is not just something that have started now. We all remember Sierra Leone is a country that went through 11 or 10 years civil war, and after the war in 2001, actually, there were a lot of issues with respect to drug trafficking. It's as a result of those who were involved in the war were using drugs, and all of that actually paved way for drugs to start surfacing in Sierra Leone. So after we had the war, the peace negotiations, there were these issues of we coming together as a nation to see how best we can tighten up the screws so that what happened as a result of the breakout of the war could not repeat itself again. So in that case, there were things that Sierra Leone had to put together. So by then we had in 2002, the agency was established, but by then it was called the National Drug Control Agency. So it started full operations on the 9th of January in 2003. So 2002, it was established, and then in 2003, it started its operations. But by then, it does not have the legal mandate to arrest, to prosecute, to investigate, and to offend or to do anything to those who were offenders. But if you fast forward, let me take you to the Colombian national plane that actually landed at Lunge International Airport in 2008. That actually brought about the establishment of the agency now, because at that time, of course, at that time, there were this issue of certificate emergency so that those who were involved in this particular incident could be tried. So in 2008, there was this emergency certificate that was passed into law. So that is how the agencies actually started operation. Go to the next slide, please. The next slide, please. So what is the mission of the National Drug Law Enforcement Agency? The mission of the National Drug Law Enforcement Agency is to coordinate a national, sub-regional, and international multi-agency strategy to increase public awareness, education, research, treatment, rehabilitation, and enforcement in the control of substance and illicit drug trafficking in Sierra Leone. So this agency was not just established to serve as an agency for just prosecution, but we have a mandate to go to the extent of having research materials to create awareness, public education, prevention information, and as well as to pave treatment pathways for those who are severely affected by drug and other harmful substances. So we have a vision of making Sierra Leone a healthy and wealthy nation free from the harm caused by substance abuse and illicit drug trafficking. That is our vision. We want to see Sierra Leone become a drug-free nation. We want to see Sierra Leone become a nation that we cannot have or in any way tolerate drugs. So presently, what we have worked on is a zero tolerance policy. We are in every institution, we sign to that policy to ensure that we ensure a zero tolerance drug policy in workspaces and even in our everyday activities. So if we have gone to that extent of having that zero tolerance policy, is to tell you how serious the government of Sierra Leone or the people of Sierra Leone or the agency is fighting seriously to ensure we have a drug policy to make Sierra Leone a healthy nation. An overview of the present efforts in the fight against drug abuse and illicit trafficking. What have we done so far? What are we still doing? So the agency, alongside its partners, that is since the establishment of the National Task Force. So we have what we call the Rehabilitation Program, Rehabilitation and Treatment Program, the CSA platform established. So at the National Drug Law Enforcement Agency, one of our strengths has been the partnership with civil society organizations and ensuring that we're able to reach out, because In fact, it is through this partnership with CSOs that we've been able to get access to information that leads to arrest of hardcore criminals. And this is as a result of our partnership with these civil society organizations have been helping so much that we'll be able to get some policies like harm reduction policies. We work with one of the institutions, SRYDCL, who actually does needle and syringe programs. And each time when they are going out on their outreach programs, we are always there with them to ensure we have a collaborative effort. We have what we call the Civil Rights Defenders Group, which as well we are working with in close ally. We also have what we call Institute for Drug Control and Human Trafficking, as well as these are all civil society organizations. And all of these civil society organizations, they came together to form one platform wherein they can be able to collaborate information and share some of this sensitive information with the agency where and when it's needed. And so we are working with civil society, and there is a strong collaboration with the agency and that of the civil society collaboration, civil society establishment. So rehabilitation and treatment programs, we as an agency, we don't actually do clinical because of the mandate we have. But what we do, we provide what we call referral pathways. We are in close partnership with the Senior Psychiatric Teaching Hospital and as well as the government establishment of the National Task Force, that is the Ministry of Social Welfare, who does with who actually deals with rehabilitation and treatment program. So they have the facility at PMTC, Peace Mission Training Center at Hastings, which we also work there in close tie with them. But however, the agency through this rehabilitation and treatment program, before now it's as if we knew that there was going to be an outbreak. So what we did was we lobbied with ECOWAS. ECOWAS actually trained 25 Sierra Leoneans to serve as what addiction prevention, addiction treatment specialists. So these addiction treatment specialists are from different walks of life. We have participants from the Sierra Leone Correctional Service. We have participants from the military. We have participants from CSOs. We have participants from different walks of life. So that is the number that made up the 25. And these people are trained specifically to be treatment or addiction treatment specialists for people who are severely affected with drugs or other harmful substances. So these rehabilitation facilities are supposed to have these addiction specialists to be in those various facilities to see how to actually handle the affairs or activities related to addiction cases. However, the agency, we do not actually deal with clinical services, but we provide treatment and referral pathways. Maybe we have what we call policies for rehabilitation programs. We have regulations how a rehabilitation facility should look like, what should be the composition of a rehabilitation facility, what needed to be in a rehabilitation facility, and how to go about the registration. And the Ministry of Social Welfare have what we call the Social Services Act, which gives the professionals that are supposed to serve at those rehabilitation programs. But one of the challenges with respect to that, I'll come to challenges later. However, going forward, since the establishment of the state of emergency, in the government of declared national drug, which we call push national public health emergency, and for drugs, particularly and those who smuggle them into Sierra Leone. We have what we call the establishment of the task force. The establishment of the task force is what the government of Sierra Leone actually did to ensure that this task force should be a zero tolerance. So whosoever is apprehended or arrested by this task force, it means that individual, the law will take its course to the fullest. And the agency is mainly working on the fifth pillar, which is the law enforcement pillar. So the task force is divided into five main pillars. And who is the head of the task force? We have he's not a retired, in fact, he's still active. Professor Major Furisa. You understand? And he is the head or the national coordinator for the National Task Force appointed by His Excellency the President Julius Maada Bio. And then we have the task force pillars. We have the prevention and awareness campaign pillar. Of course, that one is headed by the Ministry of Local Government. So the task force is a composition of multi-sectorial approach to ensure that every department, every agency, every other institution come on board to see how best we can all collaboratively work together to fight against drug and harmful substances. So it is a multi-sectorial program. It's actually effective and it's doing its best to ensure that we are able to curb or put an end to drug or drug-related activities in Sierra Leone. Going forward, we have the care and treatment pillar. The care and treatment pillar is mainly headed by the Ministry of Health and also supported by the Ministry of Social Welfare. So each pillar is headed by one specific ministry, but given support by different other ministries to ensure that there is a collaboration, there is a synergy, and there is an interrelationship between the various ministries to show the effectiveness. And of course, we have the social reintegration pillar. The social reintegration pillar deals with the rehabilitation and reintegration. It's mainly headed by the Ministry of Social Welfare, and then it has a co-pillar lead, the Ministry of the National Drug Law Enforcement Agency, the Ministry of Information, and all of this. So we have the other one, which is the risk communication, of course, the building of flyers, the communication of information, threats to public or national security. All of that is under the risk communication. And then the last but not the least, which is the law enforcement, which has a primary mandate to ensure we're able to cut down the supply route. Because there are two things when we talk about drugs. We talk about the accessibility and we talk about the availability. The drugs will be available, but if it is not accessible, then that becomes a safeguard for the minors. Because one thing, if you're an adult, you choose what you like. But what we are preventing is to ensure that, yes, minors don't get themselves into drug use. And you don't make the choice of starting to use drug at a very tender age where you are still developing your mental. So that is one thing we are trying to see how best we can work on. And as a nation, we are committed to ensuring that we have a safe Sierra Leone, we have our people health restored again. We have another one is the major drug seizures and destruction. In July 2024, a joint operation by the Transnational Organized Crime Unit, of course, the Transnational Organized Crime Unit is a security operation forum. That security operation forum is composed of different security sectors and institutions that are all related to security measures. For example, we have the Sierra Leone Police, we have the military, we have the IIS, we have the NRA, we have the different border patrols team, we have the Navy. All of that is composed of that of the TOKU. So TOKU is a very wide, a very large security composition, and it is based on these particular security operations that we did a joint operation together with the Pharmacy Board Sierra Leone, ONS, and we did a destruction worth $94 million worth of illicit drugs. That was in July 2024. And these destructions were done in kind of series of ways. In mid-July, a second mass destruction worth over $96 million of illicit drugs, of drugs known to be Captagon. That is that was like a major breakthrough within that area of July 2024. So, which shows the further commitment of the government of Sierra Leone in the fight against drug and illicit trafficking. Hello, are you hearing me? We go to in December 2024, another large-scale drug destruction was carried out by the police, NDLA, and TOKU together with Pharmacy Board. So we are really serious with respect to this zero tolerance policy. And that is why presently the Minister of Internal Affairs is pleading with every institution. In fact, it is not a matter of plead. every institution, even schools, are signing to the zero tolerance policy. Of course, that zero tolerance policy indicates that any individual who within his time of work or after work is seen using drugs, then that person, the law will take its full course on you. But the government have been so magnanimous to look at the drug situation in Sierra Leone instead of arresting, because the NDC Act, which is the National Drug Control Act of 2008, spells it clearly that anybody found in possession of drug, you understand, that is part 3, section 8 of the National Drug Control Act, spells it clearly. Anyone without no discrimination, without no particular description to what quantity you should be possessed of. You are found in the possession of drugs for the fact that it is a contraband substance. The law says you should go to 5 years or more imprisonment. If you are found trafficking, it's a life imprisonment act. So, but now, because the government wants to be very magnanimous and look at its citizens and says, okay, we are not going to just incarcerate all of you into the prisons, it's going to congest the prison. So in other words, let's decongest the prisons and pave way for those who are victims to be treated and then reintegrated again into society. It's like giving the youth or those who are involved into drug use a second chance. So now the law has been a little bit flexible, which is why we are even asking for a review of the act, because I know that one falls on our harm reduction policies. So we look at it now to say we have victims, we have perpetrators. Those who are perpetrators, the law is very hard on them. Anyone arrested in the case of being a perpetrator, the law will not take it lightly with you. You will go to maximum, they will charge you, and the law will take its course on you. Whatever happens to be the case, it becomes the result of that particular law. Then 6, it says what? Chemical lab testing. In February 2025, we have GI Talk. GI Talk is Global Initiative Against Transnational Organized Crime. It's an international organization for research on drug and other substances. So this team of researchers came, we collected 39, in fact, it was 93 samples we collected in Freetown and other parts of the city and within the urban and western area settings. These 93 samples, we are able to use some of these samples using the FTIR spectrodiometer testing tool. And using that FTIR testing tool, we are able to notice that almost all of these substances have nitrizines. Those of you who are familiar with nitrizine, nitrizine is a drug, is a chemical that was produced in 1950s in the laboratories of the United States of America. How did nitrizines escape from those laboratories into Sierra Leone and into those compositions is what we still find a mystery. But we are able to notice that nitrizine is a very high synthetic cannabinoid or a very high synthetic drug or chemical, which is 10 times potent than even what we are talking about, or others known as fentanyl. So it means we are dealing not just with kush, we are dealing with what? Another active ingredient. That is why we call it a synthetic drug, because it has a composition of different mixtures. So when we had this outbreak and the formation of the task force, we had to struggle with the case definition of what is kush. We had to struggle with the case definition of how kush is composed, and the kush in Sierra Leone, what is the difference between Sierra Leone kush and other parts of the world kush. So there are different names for kush other places, but in Sierra Leone, our own kush, we came to realize from that particular test, we know that it has what we call the nitrizine composition. Going forward, there is this call for fast track drug court. So that takes me to what we call the overview. We are still on the overview. In March 2024, the Inspector General of Police urged Parliament to establish a dedicated fast track court for swift prosecution of drug traffickers. So that could be one of the challenges, but under the overview, that is what presently we are pushing for. To see how best we can have a fast track court for what? For prosecuting of drug cases, because we might not want a case where the DPP, which is the Director of Public Prosecution, have to hold on to the matter for some time, looking at the particulars of offense, looking at what section or what offenses or what charges to make on these individuals, so that we look at it as if the person is arrested for drug-related crime, they charge you today, tomorrow, or today you appear in court. That way, we think we can be able to fast track, and those who are arrested will just face the law, and before you know it, they are down the gutters. Then we have what we call enhanced international cooperation. In mid 2024, we still had what we call the Ghana DEA and US Embassy collaborated with Internal Affairs, that is the ministry, that is the Minister of Internal Affairs and the Sierra Leone Police, to disrupt prosecutors' supply chains and dismantle push labs. So we know that there were clandestine labs. These are not laboratories, but we know this time because there are no legal laboratories. So these illegal laboratories have been. There was this particular lab that we also and we are able to arrest some active chemicals, like in the teaching we are talking about chemicals that we have found. At the end of the was as a result of collaboration, ongoing town hall and campaigns, and open to so that is that is all public at public places, open air, community sensitization on the dangers of substances. And we also have conducted trainings of trainers so that we're able to have drug educators, to be working across the country with respect to how they should mitigate the problems of the country. And the second segment of my presentation is that is to say, if you go back to our penal, if you go back to the National Drug Control Act of 2008, you see these are just for you to know that, but yet still these laws are obsolete. We still need to laws that will meet the present growing trend of drug dealers or and if we don't continue to change the laws and make the laws intensify more, they have to encourage them, encouraging themselves into this drug. This is something people to join us in our campaign so that we can have a national drug review again and then see how best we can reform some of these laws that will meet the present trend. Section 3, of course, national drug control is very look at section 7, importation, supply, sales, and export. So these are strong laws. All of them, it says they are liable for life imprisonment. For section 7, it says it's life imprisonment. For section 8, it says what? It's 5 years imprisonment for those who are prohibited. The possession. So now the government have made some MSC on the state for possession. Now it says not everybody that possesses look at those who are perpetrators. So perpetrators are quantities. There is a benchmark within the tax force framework. If you have quantity, automatically considered a perpetrator. So that is how we are able to differentiate to make charges those who are apprehended drugs. Section 9 prohibits the acquisition. That is to say, in the process of using the drug trade and they are acquired property, what should be done? So the law makes provision for the confiscation of properties, what you have acquired during the time of your business trade. So we go to section 10. You see what section 10 says: prohibit the possession of equipment for manufacture. So in fact, in that one of our joint operation, there is an equipment which was seized. and that one is in custody of the DPP and TACTOCU, the Transnational Organized Crime Unit, for safekeeping, because we need to do more with regards to those properties. You go to the statistics. If you go to the statistics, you see the most prominent drugs used. We have still tobacco, alcohol, cannabis, heroin, tramadol, ecstasy, meth, cocaine, kush, and in total, you see for kush alone in 2024, we have a total of 1,101. That is for those who were able to access a particular treatment center at SLPTH, that is the Sierra Leone Psychiatric Teaching Hospital. Those who were able to access the facility for treatment purpose, we had a record of 1,101 individuals. And among these, 1,028 of them were male and 73 of them were female. So for Kush, that is the number. See how high that number is. So imagine this number is way triple, because we are not for those who are able to access treatment facility.
Hello? You get me?
Hello? Hello?
Mr. Ibrahim, we can hear you. Mr. Ibrahim, we can hear you.
Okay.
Wait,
So I'll be short soon. So what we are saying is, these statistics in front of you, we are on slide 13, please. Can you show slide 13? Hello? Can you please show slide 13? Thank you. So yes, so you see the statistic, it tells you we have for Kush alone, we have 1,101 users, and that is for those who are able to access the treatment facility at Kisi. That is the Sierra Leone Psychiatric Teaching Hospital. So it means there are thousands more who aren't able to access treatment facilities. So we still have a challenge with respect to having more affordable treatment facilities for those who are severely affected by these harmful drugs. And this statistics further goes to give you the demographic variables of the age of those who are involved. You see, from 15 to 19 years, we have a number of 148. And out of this 148, 141 of them are male and 7 of them are female. There is this age, meaning we have an age bracket of drug users at that time from 15 years of age. But if I tell you for current, we have way below that number of age of drug users, which means where is our population going? What is happening to our growing population? Our youth, our brothers are severely addicted to these substances, meanings that is affecting their lives, their education, and their well-being. And then we go to what are our challenges? Of course, there is no project, no activity or institution that do not face challenge or do not face challenges. So we have what we call limited capacity of personnel and logistics. Of course, the National Drug Law Enforcement Agency continues to lobby with government. We know governments have competing priorities to ensure to be able to provide for the country. But yet still, we are pleading, we are continuing our lobby, we are continuing our plea with different other organizations, different international organizations, philanthropists, and whosoever that is concerned with respect to these issues of drugs, to see how best they can be able to look at the personnel or the logistics that we need. What are some of these logistics? We need more vehicles, we need more electronic appliances to see how best we can be able to like drug detection gadgets, to see how best we can be able to fast track the drug dealers, because if we are not able to be ahead of them, then definitely if they are ahead of us, it continues to be a problem. So we have what we call the weak judicial framework. So it means the judiciary has two laws normally which they look at. They have the Pharmacy Board Act of 2001 and they have the NDC Act of 2008. At times, when they go to some court case, they will prefer to use the Pharmacy Board Act on them, which is which has some minor punishment. So there are times we are all still lobbying so that we can still just be using the NDC Act, and we know the NDC Act as well is obsolete. It has existed for over 23 years. So it means we need to see our best to upgrade that NDC Act if we are to take it from 2008 to over 17 years. So I think we must and we need time now to see how best we can upgrade through a review program for those acts to have a new format. And then we have what we call lack of trained mental health professionals. There are still challenges with respect to having mental health professionals across the health facilities, the hospitals, the PHUs, the public health units, and CHOs. Most of these facilities do not have mental health professionals. So there is need for us to train more mental health professionals. Of course, we look at the youth vulnerability and unemployment. Somebody just made mention of the employment status of youth. That continues to be a problem. But again, there are some people who are still, if you go back to our table, our demographics, it will tell you that we still have people who work, but yet still they choose to go to drugs. And at the end of the day, they end up losing their job. So it's different at times when you have those who are not working, who are into drugs, and those who are working, who are into drugs. So at times again, the youth vulnerability again and unemployment problem is a serious challenge towards drug issues. And then we have what we call inadequate rehabilitation facilities. We need to have more space for the National Rehabilitation Facility. Of course, through the National Task Force framework, we've been able to establish regional rehabilitation facilities in different parts of the country. For Freetown, we have the PMTC. For Bo, we have the Gundama. For Makeni, we have the Tekobat. And for the north, we have, for the north, we have Teko Barracks. For the south, we have Bo, Gundama. And for the east, we have the Daru military barracks. Why are we using a military barracks? Because we want to look out for the safety and absolute control of these service users or these people who are going through rehabilitation. We want to be sure of their security status. And that is why we are using the military facilities for now. But we are looking out for an opportunity wherein we can have a greater or more adequate space for rehabilitation. It will not just be at regional level, but maybe we can have it at or at every be able to have all these things. We have poor in Sierra Leone and Guinea. There are lots of poor border crossing points between Guinea and Liberia. There are between Sierra Leone crossing points as well. So all of these areas are to address. In other words, to have a different places to be there. So to ensure that on our citizens for that. What are some of the lessons learned? We have learned through the multi-sectorial approach that it's an essential way to ensure problem. So the community touching on health, security, education, and the economy requires a joint effort to protect it. That is why
Hello, please. Can you actually mute? Please mute your mic.
So that is why the establishment of the National Task Force on Drug and Substance Abuse shows the power of interministerial coordination working together, like so that we can all coordinate and work to ensure we have a safe and effectively. And we also have what we call the youth engagement is very critical. Youth engagement, continuous youth engagement. And then we look at what? We look at certain environments. We have what we call look at the strength of the community, what are the opportunities of the youth. Now we have developed what we call the CADA, the advocacy network. So the community work within communities to ensure that there is community collaboration with law enforcement bodies so that we need to know those within communities who are continuing to be problematic. So we have stakeholders engagement, landlord engagement, youth engagement, and look out for sports to engage the youth instead of being idle or not doing some other activities. So these are some of the things we are looking at to have critical youth engagement based on their various strengths within their communities. So we have what we call community and interreligious and religious leaders play a pivotal role. For Sierra Leone, we've largely
Yes, I'll tell the next person is beyond 20 minutes.
hello.
Look,
So
Mr. Ibrahim, I think you need to wrap up.
I'm wrapping up. I'm just at the very one last slide. So
Okay.
we have what we call community and religious leaders play a pivotal role. Of course, really interreligious council, Sierra Leone is known as one of the countries that have a very strong interreligious policy. In fact, we are known all over the world for having religious tolerance because we have this culture played, religious play within various spheres of life. So we are also encouraging religious leaders to always preach out the messages to their congregation with respect to drug and substance abuse. And finally, the last but not the least, civil society and media are key allies. So these are our key allies, the civil society group, the media groups. We are as well engaging the fourth estate to see how best all of us can collaboratively work together to ensure we are able to come up with information to stop people from using drug and substance abuse. We have the international cooperation engagement. Of course, this enhanced impact. It's in the partnership with Ghana DA. So you see, we as well with we work together with WAPIS, West Africa Police Information System. We work together with the West Africa Epidemiology Network on Drug Use, WENDU. So we are in partnership with the international bodies. We are in partners with our friends from the LDA, the Liberia Drug Law Enforcement Agency, to see how best we can strengthen interborder cooperation, as well as with our Francophone experts from Guinea to see how best we can strengthen the border cooperation. If there are any other questions, I would like so the law enforcement alone is not enough to just fight against drug. It means all of us need to have collaborative synergies to see how best we can fight drug and harmful substances. So if there are questions, I am available to answer some of them. Then the ones that we are not able to address, then I think we can discuss them when the line is open for discussion. Thank you very much. God bless you.
Thank you very much, Mr. Ibrahim. We must confess that was a detailed presentation. And Mr. Ibrahim has brought to the fore quite a number of things. He has noted the establishment of the NDLA in Sierra Leone. He has made us understand the mission and the vision, the works of the NDLA Sierra Leone with ECOWAS in terms of establishment of 25 addiction treatment specialists. He has also brought to the fore the establishment of National Task Force on abuse. He has noted Sierra Leone's zero tolerance policy on the use of drugs and the call for the fast track court for the prosecution of drug-related crimes. He has brought forth as well statistics on drug users, challenges, lessons learned, and key recommendations. Indeed, it has been a big package, helping us to understand the work of the NDLEA in Sierra Leone. He has also made it known that NDLEA does not just work alone, but it is with other related agencies, and he has called for a multi-sectorial approach to tackling the issue of drug abuse and illicit trafficking. On that note, I would like to bring to the fore the third panelist for today, and I greatly implore that the third panelist should keep to time because we are running out of time for the webinar. We just have 20 minutes for your presentation. So I'll bring to the floor Mr. Ibrahim Zuba, who is the Director of Prevention, Education, and Training at the National Drug Law. Oh, so I'll bring to the floor Mr. Pastor Domingos Ter. He's the Director of Drug Addiction Rehabilitation Center, Guinea-Bissau. He's speaking to us on the topic drug abuse and illicit trafficking in West Africa, the health implication and treatment options. Mr. Pastor will be speaking in Portuguese. So I implore that you go to your translation for those who will need in the English translation to understand his presentation. On that note, I bring Mr. Pastor to the floor. Sir, you have the platform.
Patience, please. Please, patience. Before Pastor take the floor, we are asking all participants to put the name of their country before their names, so we can identify the different countries that are around. Thank you very much. S'il vous plaît, les participants, vous êtes priés de mettre le nom de votre pays après votre nom. Nous pouvons identifier les pays qui sont présents. Merci beaucoup.
Mr. Pastor?
Hello?
Yes. Go ahead, sir.
No, it's Duba. I was just thinking. If there are no questions for me.
Oh, so we will come to the round of questions and discussions when once we are through with the third panelist. So we take all three panelists together. If we have Mr. Pastor Domingos on today's webinar, he should take his presentation.
It seems like the pastor is not connected. Maybe he's facing some connection issues. Patience. Maybe can we take some questions? A round of questions for the two first panelists.
Okay, that's fine. That you can go ahead and communicate with him so we know if he will be available for today's webinar. Okay, on that note, I'll quickly go to the chat box. I think I have two questions presently. If you have questions, panelists, or resolutions, kindly indicate by a raise of hand, then we also hear from you, give you the floor to hear from you. I have Maxim here, who has asked the question, how can we reduce stigma towards drug users and promote recovery? We also have a question from Francis. Francis is asking the question, in many African countries, including Sierra Leone, young people often turn to drug due to unemployment and lack of opportunities. What sustainable policies on youth-driven solutions can government and civil society adopt to address the root causes of drug abuse? This is in Sierra Leone. Francis also asked the question, illicit drug trafficking continues to strive in regions with weak border control and corruption. How can young people actively participate in community-based efforts to combat drug trafficking and advocate for accountability in law enforcement? These are the 3 questions we have in English. I know there are some questions in French. So I request that our French colleague look through the questions or the chat box and also itemize the questions in French. So while we wait, I hand the floor to the panelists to respond to the 3 questions. Our panelists from Sierra Leone.
Hello.
And also Mr. Edwards. Go ahead.
What for the first question that what enforcement agencies to discourage, or what way should we work towards the reducing of stigmatization?
Yes.
I think that is the first reason why it says breaking the chains through what? Prevention.
Hello. Please, can you actually tell Dennis to turn his mic off?
Thank you very much. So, hello?
Go ahead, sir.
So I think one thing we all need to understand is the fact that drug users should be treated from the point of empathy. So in fact, if we look at it, say we are sympathizing with them, maybe we are just hoping that they recover from that of their state. But when we empathize with them, we consider ourselves in their situation. So stigma should not be a thing that we should be bent on. So I think we have to, first of all, create the avenue, because there are lots of secrecy with respect to how people are attending to drug related problems. There are people who may even think discussing drug problem within the family circle is a taboo. So I think we have to break the silence with respect to that. Raising our voice to it, it simply means we have to make sure we create the avenue for those who are affected families, affected parents, affected individuals. Let them get the platform to speak up against it. Let them get the platform to express what kind of feelings or emotions they are going through. So I think by one way of breaking discrimination among drug users is to give them the platform to express themselves. People don't have the time to listen to the problems of others, because I know addiction is a brain cause, it's a brain disease. So when somebody is into addiction, that individual is not by himself anymore. It's not by himself anymore. So that individual needs an extra attention so that they can receive some help. Look out for what kind of actions should government organizations put in place, in other words, to help youth. Like somebody was mentioning, in Africa, most of the problems that lure drug addiction because of the employment. Yes, because Africa policies is just based on government to provide jobs, government to provide employment. But if we start to look out for the private partnership deals, let government start to see how best they can partner with bigger private organizations, the creation of factories, the creation of more employment programs. And I think by so doing, we can have a lot of youths being encouraged into some other things. Agriculture, for example, if we don't look, if we start to look at agriculture from that just tilling of the soil, we look at agroeconomy, we look at agriculture in fisheries, because fisheries is agriculture, but people are just thinking agriculture is just the tilling of the soil. If we can invest more into agricultural activities, that we encourage the youth to think of agriculture as a livelihood program, as a developmental scheme where they can get themselves involved into. And these are some of the platforms I think we can be able to curb the problems of addiction. Because at the end of the day, if they just involve in, people go to schools, they go to universities, and they graduate, at the end of the day, there are no jobs. And because they sit with frustration, they sit home not doing anything, being chastised by parents, still depending on parents to feed them. It becomes cumbersome on those individuals. It becomes so difficult for that person to think straight. And by so doing, problems, people don't invite problems, but problems come. That's the way of life. Problem and solution is what always we look out for. But we always try to see our best to make amends with respect to the situations we are faced with. So for me, I think lobbying with government to involve more private sectors into employment activities, again, is a good thing. And then see how best we can improve on a large scale agriculture by promoting those who want or who are willing to go into agriculture. For example, at the National Drug Law Enforcement Agency, one of the things we hope government will support us on is to see how best we can have our people work on state farms, agricultural projects. So those who are arrested for minor drug crimes, after going through rehabilitation, they go through the reintegration programs by going through doing agricultural activities. At the end of the day, they are working and they are being paid. They are not being paid directly, but their monies are being saved for the number of time that they are going through reintegration, the number of months that they are going through reintegration. So when they come out, they have something to start up with. They have a startup business. They have a startup career, startup thing, because they've learned practically that agriculture enriches them. But this inflow of people coming from the provinces, all just going to the capital, hoping to get political connection, hoping to affiliate themselves politically, I think that is where the problem of pressure comes in on government, and always we have problem people resorting to taking drugs. I end my case. Thank you very much.
Okay. Thank you very much, Mr. Ibrahim. Mr. Edward, do you want to add on to that before we
Yes.
proceed?
Yes, I think Ibrahim has actually made the point, and it's important for us to underscore the fact that drug and substance abusers are heavily stigmatized and also criminalized as well in our society, and that is a key barrier to particularly those who want to come out to seek help. And the public and all of this way in which we go around them, bad mouthing them, talking about them, even at some point in the family, they are rejected. And if you in your family, you don't have the solace, you don't have the support that you need to be able to come out from that situation, then society also will not be able to accept you. So we are saying that we have to make sure that we normalize public education, public dialogue around drug and its implications on the lives and livelihood of our society. We should not only see it as an individual family problem or an individual user problem, but it's a society problem. So we have to look at it from that perspective so that we can bring this discourse back to mainstream debate. We have to talk about it. The laws have to be revised. How do we handle people who are caught? You know, Ibrahim was talking about reviewing the laws. Yes, so the laws do not only look at, we should let the law not only look at the punitive measures, but also how they emphasize on preventive measures as well. So that, you know, more emphasis should be placed on those, particularly the high and mighty, who import some of these chemicals or some of these synthetic products in the country, so that these young people now use it to make all these concoctions and all of that. So that should be the key focus. And then those who are into it, how do we get them and rehabilitate them and make them useful in society? That's what I was saying when I was presenting, that we have to look at prevention, we have to look at rehabilitation, and we have to look at reintegration. These three pillars should be harmonized so that we can be able to handle this whole issue and deal with it once and for all. So that debate has to come back. We have to make it nationally driven. It has to be locally owned as well, and we have to let the discussion be from bottom up. How do we as a society support our young people and get them out of this menace? And then I think the other question that somebody asked about was it the question on African countries and young people often turn to drug result of unemployment and lack of opportunity. What sustained policy or youth-driven solution can government? I will say here that, every government has a youth policy, and those youth policies, were well crafted. And in Africa, we don't have drought in these policies. What we are lacking is implementation. Okay, where lack of implementation is the issue. So we have to ensure that we go back to basics and look at these policies and see what works and what does not work, and how do we take it forward. You can't have a policy that is as good as just being on paper without strategic framework for implementation. So we have to translate those policies into action and ensure that we're able to create jobs for young people, as Ibrahim emphasized, and I also emphasized in my presentation. So we don't only look at probably the formal job where they have to go and wear white shirts and tie and sit in the office. No, but there are other jobs that, as Ibrahim emphasized, agriculture is there. It's a whole new domain in our context, in the African context. How do we diversify our agricultural activities to ensure that young people are, young people find it very interesting to go into agriculture and be able to plant productive products rather than going to cultivate marijuana. We have to invest in green jobs. We have to invest in ICT. We have to invest in the creative industries. We see how Nigeria is also doing a lot of work in that, where youths are into movies. All of these are things that can help move the development of the country forward. So not only waiting for government appointment or government jobs, or waiting for jobs in the banks or or as a journalist or working for a whole industry, but you can create the opportunity yourself. Social entrepreneurship is now the domain. You can go there and find a way. Now you can use technology, you can use the tool that we are also using to put these nefarious things out there, but to let youth and young people be able to utilize the good parts of technology to be able to make resources as well. And I think the second question was talking about illicit drug trafficking continue to thrive in regions with weak border. Yes, we said that, and corrupt officials. Yes. How can young people actively participate in community-based efforts? In fact, I will say to that person who asked that question that you already have the answers. You can begin to do something. You can begin to work on your own youth-led civic education and advocacy program. Don't wait for NGOs or other societies to come and begin with your community, begin with your peers, begin in your family, begin to talk about some of these issues in your social groupings and networks, so that you begin to raise awareness. Single-handedly, you'll be able to touch somebody's life. Okay, you'll be able to touch and transform somebody who has already been into drugs, and you can also prevent someone who has not gotten to that level. So do something today and save the next generation. I think that is, for me, I think I will advise that you. And then also, I think we need to engage youth more.
Hello, Edward. Can I just add to what Edward said? I think, Edward, what you're saying, actually, I buy that idea. And I think one thing, again, we must all learn to do, we don't just sit and wait for everything to be given to us. At times we go out and find like advocacy you rightly mentioned. I remember before having this, before coming into government job or before starting as an enforcement officer at the National Drug Law, I started my advocacy from school. I was a teacher. I taught for over 7 to 10 years. And I started my advocacy right from school, right from the classroom. I made sure one thing I implemented in the schools that I taught was on the spot check. Everybody knows that parents are so busy now, everything that they are concerned about is money. But at the end of the day, you find this money to be used on who? On your children. If you don't check on your children, how do you know? And the child starts to take drug right from the home, thinking of how or what kind of environment the child is being groomed. What is the lifestyle of the parents? So all of that, if we are not just talking about youth, then we need to check again from the parental example. What kind of example are we leaving for our children to emulate? So all of these are some of the things that we need to know. We need to allow, give the space for people to share their stories. We need the platform. We need people to have, it's just like initially when we had this AIDS and HIV programs, people were speak about AIDS. But when the platform was given to people to start expressing themselves, the idea of AIDS is something that everybody can talk about. Don't say if you go to the hospital and you are diagnosed HIV positive, you kill yourself. Suicide rates are increasing. But at the end of the day, because the platform was made available, people started feeling safe to talk about it. And then, similarly, that's the same thing we need to extend with respect to drugs. Even the politicians' children are involved that have been affected. Families, there is no family where drug is in any country that you cannot say people are not involved. Either directly or indirectly, you'll be involved. If you are not involved directly by having your child or ward into drugs, what will happen? Your security is involved because you not have the freedom to work at night. You not have the freedom to enjoy your own hard and cash because you'll be enjoying and people will be monitoring your activities, your affairs. At the end of the day, your vehicle are not safe, parking somewhere and you are elsewhere. You will not be safe. So the security condition alone will not make you safe in that country. So it means we cannot look at this and give it a blind eye. There are a lot of things we all need to do. We need to start by raising our own voice. Let us stop the blame game. For me, I hate it when people start to blame people. Oh, Mr. X is supposed to do this and Mr. X is not doing this. What can we all do collaboratively? What can we all do? Let's encourage, let's create a culture of all of us coming together to make something happen for the good of our countries, for the good of our nation. I think we have to look at it from where we come to regional borders cooperation, regional agencies like what ECOWAS is doing. ECOWAS Parliament, we are in Africa, we are in Sierra Leone, Liberia, and Guinea, looking out for what kind of regional collaboration they should do security patrol. All of that efforts to look out for.
Thank you so much, Mr. Ibrahim and Mr. Richard. Participants, I hope they were able to answer the questions that you have put on the chat box because they've cited numerous actions on what can be done individually and collectively towards addressing the challenge of drug abuse. I have Lancina Bayoko, who has been putting his hands up for quite a while now. Lancina, go ahead. You have the floor.
Ok, bonsoir à tous. J'espère bien que vous m'entendez.
Oui, on vous entend. Allez-y, s'il vous plaît.
Moi, c'est Lassina. Moi, je suis Lassina Bayoko du Mali. Je suis membre de Youth for Peace Mali aussi. Concernant le Mali, j'ai juste quelques statistiques. a démontré concernant le trafic de drogue et la consommation de stupéfiants. Juste selon le dernier rapport, entre janvier et mars 2025, le nombre d'incidents qu'on a enregistrés, c'est à peu près 27 incidents majeurs dans les différentes régions du Mali. Et puis, il y a eu 50 personnes qui ont été interpellées, qui étaient dues au trafic de ces drogues. Et puis, le Mali, le gouvernement malien a pu saisir plus de 10 743 unités de drogue et des stupéfiants saisis au Mali dans différentes zones. Vraiment, et puis les tranches d'âge au Mali, ça va de 15 ans jusqu'à 39 ans. La majorité, ce sont des jeunes qui se trouvent dans des situations vraiment, vraiment précaires. Maintenant, les femmes aussi commencent à y vendre les comprimés. Et puis, il y a un produit qu'on appelle l'Itacol, qui est vendu dans les pharmacies, dont qui est un produit qui permet de lutter contre les rhumes. Les jeunes profitent pour acheter ça et puis s'adonner à ça qui peuvent donner des cas de décès. Et puis, au Mali, chaque 5 mois, il y a un jeune qui décède à cause des drogues et des stupéfiants. Vraiment, la situation est vraiment, vraiment alarmante au Mali. Et puis, quand le gouvernement a lancé le recrutement des forces armées de défense, les études ont prouvé qu'il y a 2000 jeunes testés positifs aux drogues lors du test de recrutement militaire de 2024 à 2025. Sur la totalité des candidats, 2000 jeunes étaient déjà testés positifs aux drogues. Donc maintenant, ça c'était les petites statistiques du Mali. J'aimerais poser deux questions aux panélistes, car j'ai suivi leur intervention qui était vraiment, vraiment brillant. Moi, ma première question, c'est la suivante. Mon pays, le Mali, fait face à une récurrence d'insécurité, notamment au nord du pays, dont l'État essaie au mieux de contrôler la zone. Mais face à cette situation, quelle solution les panélistes peuvent nous proposer, nous, en tant que jeunes Maliens, dont les jeunes qui sont au nord sont exposés aux drogues et aux différents spécifiants, parce que le climat de sécurité n'est pas installé. Donc, comment les aider pour qu'ils ne s'adonnent pas à ces genres de pratiques? Et après ça, la deuxième question, nous avons remarqué dans la capitale et dans d'autres régions du Mali, aux abords même des écoles, tout autour des écoles, nous voyons des jeunes qui sont un peu coincés, ils commencent à prendre des drogues depuis à bas âge. Quelles solutions les panélistes peuvent nous proposer ou d'autres intervenants qui ont eu qui peuvent nous donner des exemples de réussite dans leur pays pour vraiment lutter contre l'addiction des enfants aux drogues. Je remercie WANEP et puis je remercie tous les panélistes pour leur brillante intervention. Merci beaucoup.
Thank you very much, Mr. Lassina. I'll give the floor over to the
Ibrahima
panelists to
Traoré a
make one or
demandé la
two
parole s'il l'a.
remarks with regards to the question. Okay, Ibrahim. Ibrahim, then go ahead.
Ok, donc moi, Ibrahima Traoré, chargé de programme WANEP Mali. Bien, donc j'ai écouté avec intérêt les panélistes, peut-être à la suite de ce qu'ils ont eu à faire comme exposé. Je voudrais également proposer quelques recommandations dont je pense que si au niveau de la sous-région, on parvenait à les mettre en œuvre, cela pourrait impacter positivement et nous permettre de réduire le taux de consommation de substances dopantes en Afrique de l'Ouest. La première de ces recommandations clés, c'est d'élaborer et de mettre en œuvre une stratégie nationale dans chaque pays, donc de lutte contre les stupéfiants. Cette stratégie doit inclure la prévention, le traitement, la réinsertion sociale et la répression adaptée aux besoins des jeunes et inspirée des normes internationales. Donc, si on parvient vraiment à appliquer cette recommandation dans chacun des pays, je pense qu'on pourra impacter positivement. Deuxième principale recommandation, c'est de renforcer la coordination entre les différentes forces de l'ordre, police, gendarmerie, douane. Au Mali, par exemple, c'est l'Office central des stupéfiants, mais il y a également d'autres mécanismes gouvernementaux comme le MILD, qui est la mission interministérielle de lutte contre la drogue. Donc, ces structures-là peuvent mutualiser leurs efforts et partager les informations afin d'assurer une réponse plus efficace sur l'ensemble du territoire dans nos différents pays. Troisième principale recommandation, c'est d'intensifier les campagnes d'information et de sensibilisation, notamment dans les écoles, dans les lieux de regroupement des jeunes appelés au Mali grain, au niveau des marchés, dans les garages où on répare les voitures, les lieux de concert des jeunes. Et pour votre information, au niveau des concerts des jeunes aujourd'hui au Mali, on est en train de remarquer un phénomène important. Les lieux de concert sont devenus des cadres où on vend et on consomme énormément de drogue. Donc ça, c'est vraiment des constats au niveau des concerts de rap des jeunes au Mali. C'est des cadres où on consomme et on vend énormément de drogue. Donc, ces différents cadres-là, on doit vraiment les adresser pour faire en sorte qu'on puisse évoquer les dangers et les conséquences de la consommation de drogue sur nos jeunes. Autre recommandation phare, c'est de mettre en place un cadre d'échange et de dialogue multi-acteurs, composé des responsables de classe, des enseignants, des administrations scolaires et universitaires, des comités de gestion scolaire, qu'on appelle dans d'autres pays également associations de parents d'élèves, de la police, de la gendarmerie, de la douane, de l'Office central des stupéfiants, pour identifier des pistes de solutions permettant de stopper la consommation de stupéfiants dans le milieu scolaire et ailleurs. Avant-dernière recommandation, former et équiper davantage les agents de détection et de répression pour améliorer la surveillance des points sensibles. Autrement dit, on a parlé, les deux panélistes ont évoqué, nos frontières sont poreuses. Donc, essayer de faire des efforts pour mieux contrôler nos frontières, les aéroports, les gares où les véhicules partent et reviennent, et détecter sur ces différents cadres-là des réseaux de trafiquants de drogue. Dernière recommandation, développer des programmes de prise en charge, de traitement de l'addiction et de réinsertion sociale pour les consommateurs afin de réduire la demande et de faciliter leur retour à la vie saine. Voici quelques recommandations majeures que j'ai tenu à proposer et je pense que si on appliquait ces différentes recommandations, ajouter à ce que les panélistes ont évoqué, notamment trouver de l'emploi pour les jeunes, associer aux emplois créés par le gouvernement, inciter le secteur privé, mais également et aussi et surtout faire en sorte de proposer des alternatives crédibles, notamment l'agribusiness, pour pouvoir occuper sainement les jeunes. Je vous remercie.
Thank you very much, Mr. Traore Ibrahim.
One Guinée demande la parole, s'il vous plaît.
Okay. Who wants to take the floor now? Is it Ismail?
Oui.
Okay.
Bonsoir à toutes et à tous. C'est le lieu et le moment vraiment de remercier les panélistes par rapport aux différentes thématiques abordées. Et je sais que la problématique de la consommation et du trafic et la consommation de la drogue est aujourd'hui une préoccupation majeure dans la sous-région, et plus particulièrement dans notre pays. Et avant de donner ma recommandation, ce que nous constatons dans ces derniers temps, notamment en ce mois de juin 2025, une propagation accrue de la consommation de la drogue, notamment la nouvelle forme de drogue qui est en train vraiment de ravager la course juvénile chez nous actuellement, qu'on appelle push. entre le 20 et le 30 juin, qui est aujourd'hui, je crois, cinq personnes ont trouvé la mort dans notre pays suite à la consommation de cette drogue mortelle qu'on appelle couche. Et cela n'a pas laissé indifférent les autorités du pays qui ont aussitôt enclenché vraiment une lutte sans merci contre non seulement les trafiquants, mais aussi les consommateurs. Et une trentaine de personnes suspectes ont été arrêtées par les services de sécurité de notre pays au cours des dernières 72 heures. Bon, peut-être l'unique recommandation que moi je vais formuler, comme mon collègue du Mali a déjà marché sur ma langue, sur plusieurs autres, la seule qui reste maintenant, c'est vraiment améliorer l'échange d'informations et des opérations conjointes entre les agences d'application de la loi des pays de la sous-région. C'est-à-dire, je vais parler ici des pays de l'Afrique, des pays de l'Afrique de l'Ouest. Donc, c'est l'unique recommandation qui me restait à ajouter à celle donnée par mon collègue du Mali. Merci.
Thank you very much, Mr. Ismail. I see quite a number of persons that still have their hands up. And unfortunately, we cannot take any more questions because our time is up. But I will kindly recommend that for those participants that still have questions, you can email your questions to the regional office and you will be given answers to those questions by the panelists. Also, unfortunately, we could not have Mr. Pasteur come in to take his presentation. I believe it was due to network challenges. Right now, before we wrap up, I would request that we put on our camera so that we can take a group picture together.
Please, patience. I would like to say something before the group photograph.
Go ahead.
Merci beaucoup, Patience. Alors, juste vous dire merci à tous pour cette session vraiment riche et pleine d'informations. Il est important que, au regard de l'importance de la thématique, il est important que nous autres qui sommes au niveau national de WANEP, que nous puissions prendre le sujet à bras le corps et travailler là-dessus en tant que point focaux jeunesse, paix, sécurité et travailler avec les Youth for Peace. D'autres sessions seront organisées à cet égard avec le programme régional jeunesse, paix et sécurité. Également, comme point de rappel, il nous avait été demandé au point focaux jeunesse, paix, sécurité d'envoyer les fiches techniques pays. Donc, prière l'envoyer au régional, les fiches techniques d'ici jeudi, comme cela a été dit par WhatsApp. Je voudrais dire merci à tous pour la participation. Malheureusement, comme on l'a dit, le pasteur Domingos n'a pas pu se connecter. Je pense qu'il est maintenant en ligne, mais on a promis de terminer cette session à 16h30. On va devoir terminer et planifier une autre session au cours de laquelle il pourra donner ses points. Je ne sais pas si Josiane est en ligne. Madame Sombo pourra dire quelque chose. Josiane, you have the floor, please, for your closing remarks before we hand over to photograph.
Ok, merci beaucoup, Seram. Je voudrais remercier tous les panélistes pour leur présentation très brillante, très enrichissante, et aussi aux participants pour leurs commentaires, leurs questions qui ont permis de mieux cerner le sujet qui a été débattu aujourd'hui. Je pense qu'il y a beaucoup de perspectives au sortir de ce webinaire. Comme Seram l'a si bien souligné, l'objectif pour nous, c'est d'aller au-delà de ce qui est discuté pour voir de façon concrète comment est-ce que vous, en tant que jeunes, vous travaillez sur ces différentes recommandations dans le contexte de vos pays pour pouvoir faire face à cette menace, ces différentes recommandations et à développer des plans d'action pour chaque Youth for Peace pour que ensemble on puisse faire face à ce fléau. Merci une fois de plus de votre participation et on prendra rendez-vous pour une prochaine édition de Youth Perspective. Merci.
Thank you very much, Josiane.
Thank you. Thank you very much. So you are going to take the group photograph. Please put on your cameras. S'il vous plaît, allumez vos caméras pour la photo de groupe. Patience, you have the floor, please, to coordinate.
Okay, so can we put on our cameras to take a group picture together? So we can all put a face to the names that we have on today's webinar series.
James
IT, when
Benson.
once you're done, please let us know.
Yes, James Benson, your camera is upside down. Mm. Mr. Ibrahim Samuel Duba. Okay. Okay, on the count of three, give me a smile. Un petit sourire. Okay. Hold on. Just a moment, please. Okay, thank you.
You're welcome.
Thank you very much. Once again, I say on behalf of Regional Office, we say a very big thank you to the remarkable panelists we had for today. The presentations were indeed note-taking, and they are all call to actions on what we should be going back to put in place within our various organizations and in our communities, so that we are able to break the silence of this growing epidemic we have in West Africa. So on that note, we say thank you so much for taking time off your busy schedule to be part of this youth webinar series. And we look forward to having you on the next webinar series that I'll be holding in the next quarter. Thank you, and do have a restful evening. Bye-bye.
Merci beaucoup. Bye bye.